MCEDA webinar on patient engagement, tying the knot for better health. My name is Bruce Mackey, MCEDA's Regulatory and Incentive Program Analyst, and I am today's webinar moderator. In today's session, you will learn about patient engagement and why it's a vital component in effective healthcare today. You'll also hear about current research and statistics on patient engagement, and perhaps most importantly, you'll learn some useful approaches for increasing patient engagement. Finally, at the end of the presentation, we will take time to answer any questions you may have. Throughout today's presentation, the lines will stay muted. If you have a question regarding today's topic, please use the chat function of the GoToWebinar interface to submit it to us. We will answer as many of the questions as time permits. Following today's presentation, you will receive an email digest listing all of the questions and subsequent answers. If we're not able to answer all of the questions posed to us, please know that you will still receive an answer via the email digest. Before we hear from today's presenter, I'd like to briefly introduce MCEDA for any attendees not aware of who we are and what we're doing to transform the Michigan healthcare landscape. MCEDA is the Michigan Center for Effective IT Adoption. We are one of 62 ONC-funded regional extension centers across the country. We're here to provide education and technical assistance to healthcare providers. And for us, that's just Michigan, of course. We were founded as part of ARRA, the American Recovery and Reinvestment Act of 2009, and we're here to support the adoption of health information technology. We're here for the triple aim, to improve patient experience, improve population health, and reduce costs. You can see from our graphic here, we've got the 5 buckets that we aim for, with improving quality, safety, and efficiency, engaging patients and families, which is a key component for today. Improve care coordination, improving population public health, and ensure privacy and security protection. Today we are fortunate to have Bobby Calooney with us here to share her insights about patient engagement. Bobby is the Deputy Director of the Information and Technology Strategies Group and has over 25 years of experience in healthcare information technology, specifically in analytics and consumer health engagement. Over the course of her career, she has worked across the public and private sectors with organizations such as CMS, Mayo, Kaiser Permanente, Cigna, and GE. She is passionate about innovation and has much to share on this topic of leveraging health information technology to engage patients and improve health, efficiency, and satisfaction. Bobby, thank you for joining us, and I'll turn it over to you.
Thanks, Bruce, and thank you everyone who's joined us here today. I wanted to start out by talking a little bit about the shifting paradigms of healthcare and patient engagement in the context of some of these changes that are happening. You all know this because you're in the middle of this change, but we're having a lot of changing paradigms today where we're shifting from a focus on illness to the focus on wellness. We are changing the role of physicians and care teams to be more collaborative. And importantly, what I want to focus on today is the changing role of patients and consumers from passive recipients of care to active participants in the care process. So that's what our session is going to focus on today. There are lots of different definitions of what patient engagement and activation mean. And just to be clear about this, I wanted to share some of the ones I think are best with you here before we get into the topic. The Institute for Healthcare Improvement defines patient engagement as actions people take for their health, specifically the use of tools, activities, and relationships, and the involvement of both patients and their families in the care process. So shared decision-making is a big part of this definition. Another definition that I really like is Ian Worden's, which describes patient engagement as sustained participation. And sustained, I think, is a key word there because it's easy to get participation at one point in time, but having that be prolonged and sustained beyond the visit in the office is one of the main objectives. And lastly, Judith Hibbard, who's a researcher out of the state of Oregon, coins this term patient activation, which is really compelling someone to take action about their health and a patient's understanding in their role in the care team process. The Center for Advancing Health did a study back in 2010 which looked at all the behaviors consumers have to adopt to be effective navigating the healthcare system. And they defined through interviews with both providers and their staff and patients directly a set of 40 behaviors that people had to adopt to know how to make their way through the healthcare system. And it's not just about receiving care and making decisions. You can see now people have a much broader set of activities on their plate, ranging from finding care providers to understanding how their benefits apply, to shopping for the best value, to all of those other aspects related to paying for care, planning their care, and managing their preventive health care. So it's a lot more difficult today to be an effective consumer of health care given some of the changes that have happened in our system. So you are all representing the provider community, and we in our role at MCEDA hear a lot of concerns about patient engagement that I just wanted to lay out for those of you who might be skeptical here at the beginning of the webinar. There is a lot of concern that engaging patients may have a negative effect on physicians' time and money. So concerns about electronic communications and the implementation of patient portals actually increasing provider workload. There's also concerns that some of these activities aren't compensated today and may actually replace time that could be spent on reimbursable office visits. I'm going to share with you some of the research about this as we go through the webinar, but I just wanted to give voice to some of these concerns before we get started. As you know, there's many different requirements that relate to patient engagement that are part of meaningful use, and concerns about actually meeting these requirements, including the cost of implementing a portal and getting people to use the portal, getting patients to actually use it, and also re-engineering the office workflows to maintain the portal and make better use of that for your own processes. Lastly, many providers have been frustrated about patients' commitment and ability to follow up and maintain their health care, so sort of fulfill their part of the bargain. So there are other concerns here about skepticism that patients will follow through and actually do what they need to do to be engaged. You may have heard this term called, where patient engagement has been called the blockbuster drug of the 21st century. This was coined by a blogger, Leonard Kish, and he was basically making the point that if any drug had the kind of impact that we see with patient engagement, people would be very excited about that drug and there'd be a lot of adoption of it. And when we look at the research in the literature, I think it is very compelling to see some of the results that have been achieved by engaging patients as being part of the care team. So two I'd highlight here are from Kaiser Permanente and the Veterans Affairs, the VA. And Kaiser was one of the early adopters of electronic health records and patient portals. Their KP Health Connect is a tool that allows patients to collaborate with their physicians. And early on, they implemented the ability to get medication refills, e-communicate with physicians, and also schedule appointments through their portal. And when Kaiser rolled this out, they found that they reduced urgent care and other visits by 10%, and they also had marked improvements in other quality metrics like mortality here, reducing overall mortality, and also increasing compliance with targets such as lowering cholesterol levels in their population. The VA has also implemented different mechanisms for patient engagement and has a portal that they've rolled out, the My Healthy Vet portal. The VA has also used a variety of home monitoring tools to extend their reach into the patient's home and manage chronic disease effectively. And you can see here tremendous improvements in terms of metrics that are better for patients, better quality, 20% reduction in admissions, and also reduced need for treatment because of adverse outcomes with chronic disease such as diabetes, heart failure, and PTSD. And the good news about this is not only do these interventions improve quality and save money, but they're associated with great improvements in patient satisfaction. So win-win-win all the way around. In another study here, we look at the difference in a population of retirees. This study was done by AARP, the American Association of Retired People, and they looked at their population, those people who had chronic conditions and were over 50, and they compared two segments of their population, the group of their people who were most activated in managing their care and a group of people who were the least activated. And they did this definition through a survey that assessed the engagement level of the population. And you can see here that those patients who were the most engaged had more than twice improved outcomes of those who were the least engaged. So fewer readmissions, fewer medical errors, and better coordination between healthcare providers that reduced adverse outcomes. So again, marked and significant differences here between the population when you have people engaged. So this effect of having patients engaged and having better quality outcomes has been well documented in the literature. The February issue of Health Affairs was fully devoted to many different studies that highlight this. What I think is also important is evidence that these health information technology tools that can be used to engage patients also have benefits for providers in terms of improved efficiency and reduced costs over the long term. So there's always costs that are incurred after you implement a new technology, but 3 months down the road, as studies have shown, there are great improvements in provider efficiency. And a study that was just done in November, published in November in Health Affairs, showed that there's a 5 to 15% gain in provider efficiency associated with provider portals, e-communication, so electronic email communication between consumers and providers, and other mobile health tools. So that is definitely promising. I think it's always good when we're asking providers to adopt technology to highlight the benefits to all of you. Let's take a look at how engaged patients are today. I want to share with you some statistics from a couple different studies here that have been taken on consumers that really highlight both use of technology and attitudes toward engagement. The first view here I'm sharing is one that comes from Altarum's consumer survey of healthcare opinions. And in this study, back one page, in this study, what we did was ask consumers questions about what role they wanted to take in their medical treatment, as well as a plethora of other types of questions to assess engagement level. And what you see here is that, by and large, the majority of consumers, over 80% of consumers, really want to either be in charge of their healthcare decisions or want to make those decisions with input from their doctors. So only less than 10% there, that purple bar, and the very dark or lighter blue, there, less than 10% want the physician to make decisions with input from me. So that's a very good message. People are very engaged already and wanting to take an active role in their health care. We also, in this survey, asked questions about what people are doing to prepare for a doctor's visit And here we are seeing people adopt take more ownership for being prepared for their visits. You can see 38% of people saying they spend time learning about their health, and 44% bringing information to their doctor's visit. And importantly, there at the end, 64% of people preparing questions so they can make the most of that time with their physician. And then 67% of people, again, really taking ownership, knowing that physicians are going to give different advice and it's up to them to choose what's right. The Pew Internet Survey documents consumers' use of technology broadly, not just in healthcare. And the story here has changed a lot in the last 10 years even. So today we see 85% of Americans are using the Internet, 72% for health information. We also see that cell phone ownership is now almost ubiquitous. 91% of adults own a cell phone. And back in July of this year, we faced a real transition and tipped over to having more than half of those phones be smartphones. And that is really promising as we think about having that phone be a better channel for interacting and delivering information to patients directly. We also see tablet adoption increasing here, and now a third of adults owning tablets. People are always interested in how these statistics vary by age group, and we do see that there is a difference in that very older, over 65 age group, but still pretty good adoption and use, and it's trending upward over time. So very promising statistics there in terms of leveraging these technologies for the future. Optum Institute, along with Harris, did a study that looked at what they call the gap between patients' desire to engage, which I've already shared with you from our own surveys, and providers' ability to meet that demand. And what you see here from their study, which is a little bit dated, but I think still this gap exists, is that patients are really willing and have this desire to engage. You see 75% of patients wanting to go online and view their medical records, and 65% wanting to have appointment reminders electronically. On the other side, now in Michigan, we're up to 63% of primary care providers who have EHRs, so this is improved in the last year quite significantly. But there still is this gap, as you can see, between the demand and desire of consumers and provider systems. So I think that is where we have an opportunity here as time moves on. Another change that's coming down the pike here is really in the use of mobile devices and digital health devices to track, monitor, and collect information. So this, again, from our survey this past November, we found that 11% of people are using mobile health applications today. And down below, you can see what people are using that for. Predominantly today, using mobile apps to track food and physical activity, which they do a very good job of. And then we also see that 6% of people are now wearing digital health tracking devices. And by this, what we see are people wearing Jawbones or wearing Fitbits that are tracking their steps, also tracking devices for sleeping patterns and heart rates. So over the next 5 years, there is an anticipation that more and more clinically relevant data will be collected through this type of device outside of clinical settings. And I think that represents for all of you both a challenge and an opportunity, a challenge in thinking about how to receive and utilize that information, and an opportunity in really having a much richer sense of what's happening with your patients over time. All right, so now that we have a sense of the fact that patients really do want to be engaged and are adopting a lot of technology to support new ways of engagement and interaction between themselves and their providers, let's talk a little bit about effective approaches for patient engagement. To start with, I just wanted to set the stage in terms of where we are with meaningful use. In every stage of meaningful use, you can see that there are aspects of this that relate to patient engagement. So in stage 1, which many of you are in now, there is a real focus on using information to help people understand their health and also their health care and what to do next. And we see that in specific objectives that are around the after-visit summary. I'll also talk in a minute about some new requirements with 2014 and stage 1 that are coming up. In stage 2, there's more of a focus on patients being able to access their own health information online and share it with others. And in stage 3, additional access requirements and also the ability to access self-management tools online. So you can see the stakes get higher here with every stage, but with every major initiative in healthcare that is underway now, we see patient engagement as being a key foundational element. So be this primary care medical home or the changes that are coming with accountable care organizations, all of these have a significant component that relates to patient engagement. In 2014, there are some changes that are coming, and just to talk a little bit about that, 2014 really is focused again on allowing patients to see that after-visit summary and other of their health information. And the specific change really relates to a requirement that 50% of your patients be provided timely online access within 4 business days of it being available. So I think of this requirement as being providing the keys to that information. A patient has to have all of the information they need to get access to it. And that's differentiated from stage 2, which really is measuring did they access the information. So being able to access the information might involve providing the website address to get the information as well as any passwords or user information they would need to get access. As we move on to stage 2, now we're upping the ante and saying that at least 5% of the patients seen by the provider during the reporting period have to actually access that information. So not only have the information to get access, but actually go there and view, download, or transmit their health information to a third party. The second objective there is related to electronic messaging, where the provider must demonstrate that they're communicating via electronic messaging to at least 5% of the patients seen by the provider during the reporting period. Okay, so those are some requirements, and they align well with some of the things I'm going to talk about in terms of strategies that work. So in this next section, I wanted to share with you what we've seen from our own experience with practices and also what the research highlights as being best practice in patient engagement strategies. So the first one I wanted to talk about here is really as you think about how you roll out capabilities to your patients, highlighting first some of the things that are going to be most beneficial to patients. And I also have included here things that might be most beneficial to you and have cost savings to the practice. So in the industry, when people look at what consumers use most and what are most visited in a portal, it is really being able to access scheduling, medication management, and lab results, as well as the electronic messaging. Those are the things that are most valued and by consumers. And they really relate to these, what we call the 3 C's, convenience, choice, and control. And in any movement of consumerism, you see that when you're able to provide these three things, making it more convenient, easier to use your services, giving more choice and control, you see people become more engaged. So this was first documented where the airlines made the change to having check-in, electronic check-in, and giving consumers more tools. They really focused on these things, and the airlines that did this first really got more market share and had more satisfied flyers. And the same is true in healthcare. The second thing is to really focus on your promotion strategy. And sometimes through implementations, we find practices are really focused on the technical details of what has to be done. But it's as important to really focus on how you're going to promote and engage your patients. And this concept of making sure that you're promoting through multiple channels at multiple times. So there's a marketing dictate, 8 times, 8 ways that you think about how to get out new information to your population. And then also using, post-rollout, using different individuals who might have contact with the patient, be it a registration person, a checkout person, a medical assistant, the physician directly, to reinforce the value and the ability to access the information. And having, again, this happen at many times during interactions with the practice is really, really helpful. Third, there's a sense that we're making this transition to a new way of interacting with patients. And I think there's a lot of research that shows inviting patients to behave differently is really important. So the Agency for Healthcare Research and Quality came up with a whole set of resources that we've included in our resource slide here for you to really invite patients to ask questions. And they developed a whole set of notepads that you can actually order from your practice for free that really look like we have on the slide here, and reinforce to patients that you're expecting them to be prepared and have questions and be organized in thinking about those questions. So this is really just reiterating to patients the change in their role, and that they can get the most out of this visit that they may well be paying for first dollar, given the change to high deductible health care, and helping them prepare for the visit. There's also a term that was coined recently called information therapy, and it's about thinking about not only delivering care, but also delivering information that the patient is going to be using to stay well and manage any disease they might have, and thinking about your services to the patient as going beyond the health care delivered to information to engage them as well. And then lastly and importantly are all the tools that confirm patients are really understanding that information that is delivered. On this last page, 3 last important strategies here. We've talked a little bit about e-messaging and how important that tool can be to promoting convenience and efficiency, and also changing this relationship between patients and providers to being more collaborative. I mentioned earlier that many practices are concerned about increases in provider time associated with this kind of communication, but I did want to share with you the research that shows that over time, post-implementation, this kind of communication can really reduce a lot of adverse outcomes by getting the right information to the patient at the right time, and also free up capacity for those patients who might desire more direct communication through the phone. So you can think about this really be a method for segmenting your communication with patients. So those who are going to be interacting with a computer late at night and wanting to shoot off some emails to their provider when they have time, when it's convenient for them, can be met with that need through a portal that allows secure communications. And those people who really want to speak to a human being, you may be able to repurpose some of that capacity that you have by changing your call line. And we know practices who have done this, who found that one of the biggest dissatisfiers in their patient community were the call lines, the automated call lines, and they were able to change that as they implemented these electronic communications. So there's an opportunity there. So research does show that there's capacity savings, 11% capacity savings that's freed up by this e-messaging over time. The fifth best practice here is really providing open access to people's personal health information. Lots of research shows that the more open the access, the more engaged patients are. And I think it's important to actually, as you're rolling out this kind of tool, to walk patients through how they can use the information as opposed to just handing them a piece of paper as they leave, to really help them understand what you expect they'll do with that information. There are new standards coming out on the market, and your patients may be hearing about this. The federal government is doing a big consumer campaign starting in February this year about a capability called Blue Button. And the Blue Button capability is a big blue button that might appear on patient portals that basically takes that data and downloads it to a textual format that would allow any individual to read the health information. And it's really a vehicle for patients to get access to their health information. If they have their own personal health record that they're maintaining, it affords for an automated ability to import that data and also to share that information with their care providers. And if any of you have patients, parents that you're monitoring their health for, Medicare today supports this standard, so you can access your parents' health information if they so delegate that through the Blue Button standard on the Medicare site. Many of the large health payers like Aetna, United, and Cigna today are also supporting this standard. And I think over time, most of the EHR and patient portal players will also support this. So something to think about as you're going through the selection process with your own vendors. Last, and this is a future thing, but I think that practices really have an opportunity to differentiate themselves and really change their relationship with patients beyond the visit to have that more collaborative, ongoing relationship by thinking about how to leverage some of this ability to capture patient-generated data. And some practices are doing this today very simply in a pre-visit update on medications to save time, so taking things out of the office, which patients used to do on paper, and trying to facilitate and accommodate that electronically. And also, over time, changing the process of monitoring to allow that to happen using technology effectively to track progress and follow care in a way that's not labor-intensive for you and that's convenient and easy for patients. So those are the 6 best practice strategies that we wanted to highlight for you today. A couple things in talking about your patient population that I think are important is to really know something about the engagement level of your population. So if you look at this picture, the thousands of patients in your practice are likely to have varying levels of engagement today. And what we find in our own research is that health engagement does not vary with income, with age, or with education level in the way that you might think. So I think a lot of people tend to think older folks are not as likely to use technology or be engaged with their health, and younger people who are on their mobile phones all day using that might be more engaged. And we find that there are actually segments of the population that vary independent from those other demographics, as I've shown. And what's important for you is to know something about the health engagement of your practice so that you can develop a strategy that's informed by that information. So you may want to interact with people or segments of your population who are very savvy with technology and engaged in a very different way than those individuals who are not using any technology and really want the human touch. I just earlier this week got a form letter from my practice informing me that it was time for my annual physical, and it just amazed me because I'm a portal user. I'm a very avid technology user, and it's not the way that compels me to action or makes it easy for me. So it's the wrong channel for me as an individual. And I think the more you can learn about how your patients want to be communicated with and target and tailor those engagement and communication strategies to those preferences and engagement level, the better. The other thing that's important about knowing something about your population is that you can see how your ability to engage with them changes the slope of this curve. So hopefully over time you are moving people to the right as you engage with them. At Altarum, we have a survey, a patient engagement survey, our Altarum Consumer Engagement Survey, that's a set of less than 20 questions which really assess an individual's behavioral profile. So there are questions that relate to people's commitment to being able to manage their health and take an active role, how much they own their follow-up, and how responsible they are about researching things on their own, how confident they feel about making decisions and pursuing their health independently. And then lastly, this category of informed choice really measures how much they're using information to make decisions, be it about a new doctor or their health options, or even shopping for the best value in healthcare. So our survey is one that we provide as a research organization. We provide this to any organization that wants to use this, and it's something that you may want to incorporate as you're trying to understand your population. The MCEDA team provides a set of patient engagement services that go beyond our standard meaningful use support should you need it. And those services include a focus on developing your patient engagement strategy, which might involve administering our survey and helping you develop your strategy that is specific to the needs of your population. We also have a set of services to support patient engagement technology, which might include selecting a portal and testing and developing marketing materials and promotion support, or even conducting some focus groups with patients, which are all things we do routinely as an organization. And lastly, we have a set of services that help practices optimize their processes in light of new technology. So what we often find is that people are very focused on what they need to do to implement a new technology, but don't necessarily rethink their processes and how those could change to be more effective in leveraging that technology. So for patient engagement, we're specifically focused on processes like how can you make the check-in process less burdensome for patients and go more smoothly, go faster. How can you leverage online reminders effectively? What about following up on care and other sorts of patient communication? So that targeted process optimization can be very helpful concurrent with a technology implementation or afterwards to make sure that you're getting the benefits as a practice that you can derive from implementing this technology. So like any engagement and relationship, this is hard work, and it's something that you have to focus on how to make this last over time. So it's always easy to get people engaged at that one-time juncture that you might be introducing something, but the real challenge is that prolonged engagement to demonstrate that you're in it for the long haul as a practice and that they need to be in it for the benefit of their health. Some of this involves staying relevant and changing things to meet your patient's needs, and importantly, relating to this, making sure that you're getting feedback about what's working and what's not to really leverage that wisdom from your patient's own experience. So that concludes the formal part of the webinar. I'm going to go ahead and turn it back over to Bruce for the question and answer session. But before I do, I just wanted to highlight that there really is a wealth of information and resources for you. We've put those together in the presentation, which you will have online. We've put some links in there to some of what we see as some of the most meaningful and beneficial information. And we also have that posted through our MCEDA website for you. So you'll have this at the conclusion of the webinar here, but we just wanted to really put things in one place because there is an awful lot of information that can be helpful as you're thinking about your own strategy for engagement. Okay, Bruce.
Thank you, Bobby. If anyone has any questions, please use the chat or question function in the GoToWebinar interface and submit those now. We've had a couple come in during the survey, and so I'll wait for any others to pop in. We'll address a few that have already come in. First and foremost, question came in asking if we can receive a copy of this PowerPoint. I think you all should see a link to that in the chat window of your, no? Okay, we'll send it again. I sent it once. So yes, you can download it directly now. Following the presentation, we will be posting a PDF version of this slide deck as well as a recording to the MCEDA website. So that will be up within the next couple of days. Another question we had come in said, I've heard a lot of concern about getting patients to use the portal and achieving that 5% target. What adoption rates do you typically see? I think I'll take that one. My experience, I have about 10 years of experience in provider practices as well as an operations manager or practice manager, and have implemented portals at that level. And as well as the research out there that shows a great deal of people are interested in patient portals. I think recent numbers are 65+% of people are ready to engage at that level. So when you've got that many people that are already looking for that electronic access, in my experience, when you get a patient portal live, it takes off. You easily reach that 5% because there are far more people that are ready and willing to engage electronically and are looking for that patient portal. So in my view, while the stage 2 requirement I think scares some folks to say, gosh, well, how can I force my patients to how can I meet that requirement? I can't go out and make them access the portal. I think kind of the old if you build it, they will come mantra. If you launch a portal, you're easily going to get at least 5%. I think you will all find far more than 5% of people are ready and willing to access.
Yeah, just to add to that, I totally agree with you, Bruce. When I look at the literature, what organizations have achieved, and these are not all primary care practices. Some of this is integrated delivery systems. But the range is significant, anywhere between 10 and 60%. And I think what makes that different is really the extent that you focus on building in some of those hooks that are really meaningful and have benefit to patients. You're going to tend toward the higher end of that, and how much you do in terms of the reinforcing and promoting that I mentioned. Yeah. So just some statistics that might be helpful from Kaiser's experience. They have a third of their patients using their site today, and that third, it doubled when they launched the lab results and the e-messaging and the scheduling and medication management. So those were they started with a rollout that was much narrower than that and then added the functionality. And to get a big bang, having those convenient features is really important. The other thing I wanted to share with you is that that target population, most of the people were in the age range of 40 to 60, which I think is kind of interesting, and 60% were female. I always think of females sometimes offering as the chief medical officer of the home and being a key target area. And 50% of the individuals had no college degree, which I also think is interesting in terms of just reinforcing that point I made about technology adoption not necessarily being the educated, more affluent group as you might imagine.
Great. Thank you, Bobby. Another question. How could a practice use the ACE survey? Bobby, you want to take that one?
Sure. So why don't we go back to that page that shows the survey distribution. So here the ACE survey questions are ones that we actually have seen people use in a couple different ways. One, some organizations that are already doing surveys have appended these questions to their survey. So if you already have a satisfaction survey, some of our customers who are health plans or employers append this to health risk appraisal surveys. If you have a survey you're asking patients that might ask about health risks and concerns upon intake that you're embedding in your portal, this easily could be added there. We have one clinic that is interested in administering this for their diabetic patients alone, and they're collecting this just on paper forms given their population as people are coming into the clinic. So there's a variety of ways you can collect the information. Once collected, that data can be used to really think through how to interact with groups of patients, so having different strategies. You know, you may also use this information as you're interacting with individual patients. So knowing something about someone's engagement level may become as important as knowing you know, their chronic diseases and their family situation in terms of support as you're thinking about strategies for follow-up and motivating them and making sure that they have the information they need to stay healthy.
Great, thank you. Another question. Some of our patients have requested text messages. What are the security considerations? So great question. I think that's definitely a big one out there. Is how secure is text messaging? Is text messaging even allowed under HIPAA? The answer is yes. I mean, the HIPAA rule, the security rule, doesn't actually discuss text messaging, but it is allowed. But you do need to be very, very careful. I think for me, what I tell folks is you know, the messages that you send via text need to follow the same guidelines as the messages you're leaving on voicemails and stuff like that. It needs to be, you need to make sure that you're not transmitting personal health information because text messaging is most definitely not secure, much like email, much like everything else. It's just another form of communication. You definitely have to be careful. It is not secure, but as long as you are following those same rules that you apply to leaving messages or anything like that, then you're going to be just fine.
And I think it's a good question because in terms of the user experience on the consumer side, I think that's the kind of thing that is, you know, getting a text message that says, looking forward to seeing you for your doctor's visit at 12 tomorrow is very helpful to people. Getting a message that says, go to the portal, there's new information, it might not be something that someone researches until the weekend. So there's a immediacy and value from a consumer perspective if you're able to do it in a way that complies with the security requirements.
That's great. Thanks, Bobby. One last question so far, unless there are some others still coming in. We're concerned about the time required to support patients in using a portal, especially with username, password maintenance. How much of an issue is this? In my experience, that's also a very good question, by the way. in my experience, when I've worked with companies to launch a patient portal, we engaged a third party to assist in that initial wave, because that is a big concern. You don't want your phone lines tied up with people just wanting to get that access and, like having trouble logging in or having trouble registering and tying up the phone line so that more pressing patient concerns, actual health concerns can't be addressed or appointments can't be made and whatnot. So for me, I've engaged third-party companies out there that are more than willing to help with that initial wave and can take those patient phone calls to at least get over that hump of initial implementation, and where you get the first bunch of your patients that register. And then from there, from what I've seen, it kind of slows and it kind of trickles, and the provider offices, or if you have a home office or a help desk or anything like that, they can typically take it from there. Of course, that depends on your patient size as well and your company size. If you're a massive group practice with 500,000 patients, that first wave is going to be a lot bigger. So that concludes the questions we have so far. At this point, we'll go ahead and close out. I want to thank you all for attending today's thought-provoking webinar on patient engagement. And thank you, Bobby, for sharing your helpful insights and in-depth knowledge on this increasingly important aspect of today's healthcare. A recording of this webinar will be posted to the MCEDA website in the next few days. We hope everyone enjoyed their time with us today, and we hope to see you all again for our next presentation in our monthly webinar series. Next month's webinar will be on MCEDA's service line targeted process optimization, as Bobby spoke about back on slide 28. And this will be held on February 5th at 12 p.m. Eastern Standard Time. And stay tuned for communications on how to register. Thank you all.